Thanks for having us here. We're going to talk to you today about an optimization technique that we use to optimize the delivery of antiretroviral drugs to combat HIV. We know that there's been some concerns in the past with not overdosing, but using a non-optimal amount of drug in this process, and it can be pretty expensive. So that's the goal of our project, is to minimize the amount of drug that we will use in keeping the HIV level below the level that will propagate to AIDS.
Okay, so like Jeff said, our objective is to keep the virus count in infected patients' blood below the critical threshold that will cause the development of AIDS. And so we found from the literature that critical number is about 774 virus count. And so we wanted to keep it well below that, so in all of our controller and optimization techniques, we made sure to keep the maximum virus count below about 350 as a safety factor. The first models we tried a first principles model, and we tried a state space model in which we linearized the governing dynamic equations and transformed them into the Laplace space and tried to find an overall transfer function for the system that would show the response of virus count to changes in antiviral drug dosage. But those models were very unstable, and we had a hard time finding controller constants that would work for them, so we switched gears to a data-driven approach. In this approach, we fed data, or we used the models given in the literature that we had for the dynamics of the AIDS virus to generate data, and then we analyzed that data that we got.
So like Josh was telling us, we used the data-driven approach, and we were able to generate a lot of data from that model. And from that data, we implemented it into Loop Pro, and we were able to fit a model to that data, and we were able to get process constants. With these process constants, we used IMC tuning correlations to get controller constants, and then we implemented a controller for the process. These two graphs right here are just showing our implemented PI controller. We didn't include tau into our presentation because we didn't vary it, but we did get a value of tau and Kc. But it was pretty interesting to see. We wanted to kind of vary Kc and see kind of how the process reacted. When we doubled Kc, we saw that the process acted much faster, but in turn it took a lot more drug. And that's kind of how the process, the interesting trend about this process is in the beginning of the first time, at the beginning of the process, it spikes up very quick. It's kind of like a car going really fast, and in order to stop that car, you need to use a lot of brake. And it's kind of the same thing for this process. As the virus count goes up really fast, you need to start adding a lot of drug to pull it down. And so these are just some of the interesting trends that we found when we double Kc and halved it, and kind of how the process reacted to our PI controller.
Yeah, so like Corey was saying about how when the car gets up to speed, you have to apply a lot of force to stop it, and it's kind of the same thing with this. And one of the limitations of the PI controller is that you can see that this starts going up at about time equals 2, and the controller really starts kicking in at about 3 years, 2.5, 3 years. So we wanted to kind of preemptively strike there and attack the virus before it even got up to that level, so that we could basically eliminate it before it got up to speed, stop the car before it gets up to speed, same kind of thing. So we used an optimization technique to minimize a constraint over the 10 years. We actually did it over 15 years and then chopped it off at 10 years. So we decided to minimize the total amount of drug delivery, or the area under this curve, over that time. And in doing that, subject to the constraints that we imposed, you can see that there's an initial dosage of drug even before the virus really starts propagating. So it anticipates the big spike that is coming, and it effectively counter doses it even before it happens. So we're able to keep the drug dosage low over the 10-year span. So you can see that we wound up with about 8,600 drug units compared to the controller values, which are above it. So it's a much better process. The only concern and the only caveat that we would put on it is that there is no continuous feedback on it. So this is just a projection over 10 years. We don't know that that's actually going to be, there could be propagation of error over that 10-year span. So we would recommend checkups every month to 3 months to make sure that we are still following this model and that it is effectively predicting the virus count. So that's our optimization technique, and thank you for your time.